tuberculosis is not found in coughing mothers in old Bollywood films. It's here and now, and an extremely serious issue. I'd like to go over to Neelam now. Neelam, my question, for you is about the health-seeking behavior post COVID. This What kind of health-seeking behavior do you think can happen? And is it our children is it too early for children to be exposed to that kind of behavior?
Thank you, Parul, and hello, everyone. Good afternoon. So good question, Parul. I was just telling my colleague this morning, I was in Rajasthan last week, where my brother-in-law heads a hospital and is running the whole vaccination drive. And now that the vaccine for children is out, there was no traction for it, very little traction. So I actually asked him why is it that the children aren't coming forward and the parents are not coming forward. He says, "Dar nikal gaya hai." So
Yes.
so there is we also get into this whole frenzy when there's a wave, and then we all want to rush and get it. So he said, "Ab log dar nahi rahe." So I think dar to hona bhi nahi chahiye, and I don't think these are issues that can be handled by fear or pressure. So in the last 2 years, what we learned was health is important. And we are in a rat race, all of us in our lives, and I think we do take it for granted. So how do we inculcate better habits for better health? I think it has brought that to the surface, which I think is a benefit I would see from this whole experience of 2 years of COVID, that we started to reflect more, we started to dedicate more time for ourselves and our health and for our children. So, I think that's a good thing that's happened. But again, how do you sustain things like that? That I think is a challenge. So it's not easy to always, stay into this very comfort zone or a safe zone, rather. So I think with children, schools are opening up, which is a very big necessity. But then how do you sustain habits that will keep us in good shape and health? We'll decide, we will see this as we get into the fourth wave or the fifth wave. And in this morning's paper said fourth wave may be due by August, but I don't see people reacting like we reacted in the beginning. And I think, one, we are more resilient. I think we have built some resilience in our own systems and in our whole, lifestyle to better address what we, had we been more prepared in the initial stages, we probably may not have suffered as much, and many people lost dear and near ones. So I think it is an important aspect. Children must, we must as parents, I think, and Child Fund that works with very vulnerable communities, I think it is really important for Child Fund to ensure that the programs we run in the vulnerable communities and that the children feel more supported, more aware. And it's not just about, I think also the pressures we put on children, Parul, sirf padhna hai aur marks lana hai. I think all of that whole lifestyle and our, in how we engage our children with extracurricular activities, how we engage them with positive conversations, all that is going to add to them. So it's not just food or medicine, but I think this whole change of the whole agility and the dynamics and how we bring up our children has to also look at. To be changed.
Yes, Neelam, I have one more question for you before I bring in Shibu. It's about the funding instruments. I mean, the funding of TB is a focus area this year. But funding of TB has always been a challenge. You have the GFATM example before us, where the countries are yet to fulfill their commitments, the G7 countries. Given that kind of background, what is your opinion on some innovative funding models like development impact bonds or pay for performance instruments?
So, Child Fund, I think, is the first international NGO that actually has the experience of doing impact bond, pay for performance impact bond. And this is our fourth year that we are doing it. And I think we are the first ones to have experimented it. and especially, and it's more relevant for our conversation this afternoon because it's on TB and nutrition. So the first impact bond that we launched, and it's the first one in the world, is TB and nutrition. And LM, who is on the panel today, he was very instrumental in helping us design that impact bond with PEHL. So you see, again, taking a step back on this one, innovative financing is very important because as NGOs, I think, we have those very traditional way of getting grants and we still need them. But I think where is it that we see the change in, and it's a leapfrog strategy in terms of getting paid only when you show the change and show the impact. So how as NGOs, we will be more conscious that we have to give results to get paid. Plus, how do we therefore ensure that we have very robust measurement systems in place? And it raises your accountability standards to the highest. Because, no NGO can lose money. No NGO can actually do something and say, okay, I don't need the money in return. So that isn't a feasible option for us as nonprofits. For us, it is really important that we make the change that we promise and show the change. So these innovative financing is exactly in that line. And Child Fund, and as the country director for Child Fund, actually I raised my hand only because I wanted to push ourselves as an NGO, as a non-profit, that we are also about targets. We're also about showing impact. We are about demonstrating accountability and transparency on how we do our jobs and how do we actually show the benefits in the community. So I believe innovative financing is very important, not to say that the traditional methods are not, but this is really important if we want to really change the world. There's been billions that go into countries and billions of dollars have been spent in India and elsewhere. And the reason I think we haven't seen the change as much as the money has been flown into is because we are relaxed about how much do we achieve. There is no, obviously, when in an impact bond, you are penalized if you don't achieve the minimum threshold. So I believe that we need to up our game in terms of showing the impact. So I'm much in favor. So the impact bond that we did with USAID and PEHL, under the PEHL program with IP, was on, we worked with 1,000 patients, for example, in Madhya Pradesh, where TB prevalence is the highest. And we took 1,000 patients. We worked with WHO as part of the consultation. And it was, how do you, like Dr. Joshi was saying, dawai beech mein band nahi kar sakte. And that was exactly the challenge we were seeing in the field, that people would take medicine for a month or two and then migrate. And poverty, of course, is the root cause of everything in those areas. We made sure the patient took medicine for the full 6 months. We gave them immense amount of counseling and home visits, and this is all during the COVID. And we gave them additional nutrition, which is protein-led, high on protein, which therefore helps the medicine to actually, give the benefit to the human body. And we were able to show, we achieved nearly 80%, and it was an impact bond, and we did 80%. And USA then repeated the second round, and we are doing another 1,200 patients. And now the government has looked at our model and asked us to apply for the government to do 15,000 patients with the government of Madhya Pradesh. So actually, you see, we've got a model that now can be replicated across the country. They've asked us to develop an SOP, and USAID has brought in an academic institution in the middle, PGIMR, who is actually doing a third-party evaluation. And all of this is part of the NTB by 2025, because we are working with the government portal, the Nixshare portal, where every patient's detail is uploaded onto the government portal. Third-party evaluation, I think these are all best practices, and I'm definitely for it. And corporates who want to see exactly how their money is spent and shows the difference that it makes, and institutions, I think this is a really good way to do it. And I'm really proud that my team could deliver on it in spite of COVID and so many other challenges, but we did not let our patients down at all.
I think that's really interesting. I remember when GFATM was first launched in the early 2000s, a lot of countries were very upset about the clause that you'll only get the next phase of money after verification by Pricewaterhouse. And there were incidents even in India where the money was not renewed for the next phase because the uptake was not proper. It's very interesting to note from there to today in the last 20 years. It's a fascinating ride to see that. Just one last question about nutrition before I go off to Shibu. Neelam, nutrition is, I mean, I remember at DOT centers, they used to give out 2 boiled eggs and 2 bananas along with the medicine, saying that at least have this. And I've heard of HIV patients, I've heard this account myself, saying that they would feel so hungry that they would eat jars of pickle because that was the only thing they had, who had TB and HIV both. Is the nutrition challenge a hidden challenge in India which nobody really looks at in TB treatment?
I think it is nutrition. One, like I said, poverty is an issue. Now, government is also, making all the efforts that it can. So every patient, like who goes to the government hospital, that's how we work. So we have an MOU with the government in Madhya Pradesh with the health department. So every patient who goes, what they do is unko fir 500 rupees mahine ka government deta hai, DBT as they call it, direct cash transfer. So they get 500. But Parul, the situation, like the speaker Amir was talking about economic challenges, and they're significant. Now these are daily wage earners, right? So 500 rupees ek mahine mein to nahi hoga, and more often than not, it is the earning member of the family, so he can't earn. Now 500 doesn't do much. So what we did was we gave them huge amount of a huge like ration for the month. But we didn't give it for one person, we gave it for 5, taking a family average of 5. So you see, nutrition is a problem. One is access to it and capability to buy nutrition. But the second also important gap is the awareness of what should be eaten when. What is it that you need when you're taking TB medicine? And it's a very, very strong medication. And so the counseling that we added to it was the game changer. So, our counselors would go visit every patient twice a month to see wo khana bhi wahi kha raha hai. And I think what we have also been able to do is that we've inculcated a behavioral change in them. Ki there are 5 things, and like now we are, we've even made it very simple materials also, that a plate of food should have 5 colors on it. Yellow dal hai, green vegetable hai, to wo 5 color. Aise simple languages mein humne communication material bana ke behavioral change ko kiya hai. To bachon se leke till everybody in the family kind of now looks at the plate and says, hai kya 5 color? You have to make it. I think that awareness is very, very important. So yes, of course, it is very important that one, you should have the money to buy the right food, but also know what is right for you.
Absolutely. Food maps visual food maps go a long way.